Hi everyone, I am Dr. Sagar Sav and welcome to Veterinary. So today I welcome you to another lecture in the series Orthopedics. This is the second lecture. Today we will be discussing the classification of fracture. This is a very important topic. Okay, it may come as long question or short note. Some objectives also may come from this particular chapter. So pay attention. Before going to the lecture, do subscribe to this channel. If you are new, please do subscribe, and if you have not subscribed, then please do subscribe. Okay, and besides this, in the Facebook I post different cases which I get pictorially. Important one is the Instagram. In Instagram I post all the notes that I am preparing and also some case reports which I find interesting. I also post there. Instagram is very important than Facebook, so do follow me there. So this is the book which I am following for preparing the lectures of orthopedics. I will give the link in the description in this book. Okay, check the description box. So today what we will be studying, we will basically studying the classification of the fractures. So the classification can be of different types, on skin bridge, on fracture line, on reduction. Okay, all those things we will discuss in detail. The one thing I wanted to highlight that when you are getting a case of fracture in clinics, or if you have a private clinic or in government clinic or colleges, if you are finding a case regarding fracture and if you are doing some x-ray, then you are seeing a fracture of some specific bones, there is a way you have to write. You have to write in this order. First, skin bridge, I will tell you it is simple or compound. So on the first you will write like this is a simple fracture. Then you have to go for fracture line, whether the transverse oblique or short oblique, long oblique, like that. Suppose this is oblique. Okay, oblique fracture. Then you have to do the whether it is in two pieces or two pieces with a butterfly or comminuted, like that. Suppose it is comminuted, you have to write comminuted. These are coming under fracture line. We'll discuss. Okay, don't worry. Comminuted. Then whether it is reducible or not on the basis of reduction. Suppose it is non-reducible. Okay, when it is comminuted, it is not necessarily you should write it as oblique. Oblique is mostly for two piece fractures. For your understanding, I am telling how it should be written. Then on the basis of location, whether the metaphyseal or diphyseal or the epiphyseal or even the physeal fracture. Suppose it is diphyseal. Okay, diphyseal fracture. Sometimes you can also mention further classify like mid diphyseal, proximal diphyseal, like that. Then on the basis of displacement, whether it is displaced or not. Suppose it is not displaced, non-displaced. Then the bone, suppose it is femur. Okay, so it is either left or right, like that you have to write. Simple, oblique, comminuted, non-reducible, diphyseal, non-displaced, left femur fracture. Like this you have to write the fracture. Okay, that is why I made a simple way. Okay, skin bridge, fracture line, reduction, location, displacement, bone. In this way you write. Okay, make a habit of writing systematically and scientifically. First, classification fracture on the basis of skin bridge, very easy. It is two types, that is the simple or compound. Is a simple fracture or compound fracture. In book it is not written as simple or compound fracture, it is written as open fracture or closed fracture. Open or closed, whatever you use, no worries. Okay, just remember the concept. Simple or open fracture, simple or closed fracture, they are similar. It means the skin has not been breached. Like this fracture here, you see this is a fracture of the metatarsal. Here the metatarsal bone is fractured, but there is no skin breach, so it is a simple fracture or closed fracture. Open fracture or compound fracture, there is some skin breach. It is also further classified as grade 1, grade 2 and grade 3. They are classified on the basis of damage to the skin, damage to the soft tissue and damage to the bone. In grade 1 fracture, you will find skin, there will be small puncture hole. Here there will be small puncture hole. The soft tissue will be minimally damaged and the bone mostly you will find two piece fractures. fractures. Fractures, the bone will be divided into two pieces. In grade 2 fracture, you will find skin wound, extensive skin, not extensive skin wound. You will find there will the degree of soft tissue damage will be comparatively more than the grade 1, and the bone you may find the bone might have some multiple fragments. Okay, it may be comminuted, comminuted. Sometimes it may be 3-piece fracture, okay, or 2-piece fracture with butterfly. We'll discuss, don't worry. But the terms which I am using at the end of the class, you will be learning all those things. Okay, next is grade 3. In grade 3, there will be skin loss. Okay, you can see here there is some part of skin is lost. So there will be skin loss. Also, there will be extensive damage to the soft tissue. You can clearly see there is extensive damage to soft tissues, and the bone will be severely comminuted. So these are 3 grading of open fracture. Okay, so this is basically on the basis of skin bridge, simple compound, or you can say closed or open. Open fracture is further subdivided into grade 1, grade 2 and grade 3 on the basis of skin, soft tissue and bone. Okay, next is fracture line. On the basis of fracture line, in terms of further sub classification, on terms of completeness, or simply you can say that whether the fracture line crossing the both cortex into D view. Okay, here is one cortex, another cortex here. So here you can see the fracture line goes, but this is anterior one and this is the posterior surface. The anterior surface there is fracture line, but the posterior surface cortex is fine. These fractures are incomplete fractures, commonly known as green stick fractures. Green stick fractures are basically incomplete fractures. Complete fracture, no need to say, complete fracture of the bone. Okay, both the cortex line into D view, it is clearly said that the bone is completely fractured. Next, this fracture line classification can be sub-classified into, depending on the angle, okay, angle of the fracture line. It can be transverse, oblique or avulsion fracture. Although avulsion fracture technically does not come under the fracture line, okay, but for your understanding, better understanding, it is included here. You can write in exams also, no worries. So first one is the transverse fracture. This is transverse fracture when the fracture line is completely perpendicular to the axis. Next is short oblique. This is short oblique. Okay, short oblique. This angle, particular angle, is less than, it is more than 45 degree. This particular angle here. Okay, this is long oblique. You can see this angle. This particular angle is less than or equal to 45 degree. This is long oblique. Both are oblique fractures, short oblique and long oblique fractures. Another type of oblique fracture is spiral fracture. When the fracture line revolves or rotates around the axis. You can see here it goes like this. Okay, this is spiral fracture. Though it is a 2D image, if you will take another antero-posterior view or craniocaudal view, then you can clearly see that it is rotated. Okay, that is the spiral fracture. They both the short oblique, the long oblique and spiral fracture comes under the oblique fractures. Okay, transverse, oblique, and I told you about the avulsion fracture. Avulsion fracture is technically known as when the fracture happens to that part of the bone to which a tendon or a ligament attaches. Okay, resulting in distraction of the bone. Okay, complete distraction of the bone. This is the fracture of olecranon. This is olecranon process fracture. Very common example, olecranon process fracture. Oscalcis fracture to which the gastrocnemius tendon attaches. Okay, those fractures are basically avulsion fracture. Remember, the attachment of tendon or ligament to the bone, that part, if it is fractured and distracted from the bone, it is known as avulsion fracture. Okay, next classification on the basis of the number of segments or number of pieces. Number of pieces. How many pieces the bone has been fragmented into. So first one is two-piece fracture. You can clearly see after the fracture one piece and two piece. This is two-piece fracture. Segmental fracture is kind of two-piece fracture, but what happens actually after the fracture, it is three segment actually. So simply a modification of this one, where it has been, there is a segment, here is one fracture line and one here is fracture line. So you see the tibia has been has a segmental fracture resulting in three pieces, while the fibula, this fibular bone is two piece fracture. Only this fracture, there is proximal segment and the distal segment. Okay, so this is segmental fracture, or you can say it is a three piece fracture, just a modification of two piece fracture. Butterfly fracture. Butterfly fracture is basically a two-piece fracture having a butterfly segment. You see here is proximal segment, distal segment. In between there is a butterfly segment. Okay, if you will draw, then it looks like a butterfly. Okay, so this is butterfly segment fracture. So next is the comminuted fracture. Comminuted when the fracture lines interconnect with each other. Okay, here is one fracture line, one fracture line, they are interconnecting. Okay, multiple fragmentation is basically known as comminuted fracture. It is different from the segmental fracture. Here the fracture lines are not communicating. Here is one fracture line, here is one fracture line, but they are not communicating with each other. Well, in comminuted, technically in comminuted fracture, you will find the connection between the fracture lines. So these comminuted fracture can further subclassified into the minimal comminuted, moderate comminuted, and severely comminuted. Severely comminuted. You will tell a severely comminuted fracture when the fracture pieces is more than 5 pieces. Okay. So in roughly you can say if there are 3 pieces or 4 pieces, here it is 4 to 5 pieces, then it is moderate. If more than 5, when it is more than 5, it is becomes non-reducible. Severely comminuted fracture. So this is basically the fracture line classification of fracture. On the basis of fracture line, sub classification is the number of pieces. Next is the reduction of fracture, whether the fraction is reducible or not. Regarding the fracture reduction, in the next class we will discuss the I think next class we will discuss the complete detail about fracture reduction. What is fracture reduction? In the previous class I told you about the definition of reduction. Definition of the reduction, it is basically reconstructing or realigning the fracture. Reconstructing or realigning. Okay, reconstructing simply means you are doing the anatomical position, while realigning you are basically concerned with the normal anatomical aligning. Okay, so it is reducible or non-reducible. So reducible fracture is this one. If you will put a pin here and do some wearing, surplus wearing, then it can be anatomically reduced. So this is basically reducible fracture. But in this particular fracture, you can see that there are multiple fragmentation, 1, 2, 3, and these two proximal and distal segment. These are non-reducible fracture. So for this non-reducible fracture, what you can best do? There is a technique known as open but do not touch. We'll discuss. Don't worry. Okay. In the next class, we will discuss. So in that technique, what you will do? You will simply open this fracture, will not touch this particular fragment because it is not, you cannot reduce this particular fracture. You are more concerned that this particular length of bone should be preserved. Okay, this joint, this is the stipple joint and this is the hog joint, it should be preserved. Okay, so normal limb length can be preserved. Okay, so basically what you will do, you will do some internal implant or you will do some ESF like that, so that this particular alignment is intact. Okay, limb will be particular in realignment, and especially the internal rotation or external rotation will be avoided. Okay, when you will do, I told you about bridging plate technique. Okay, in the definition, you will simply put a plate here, will act as a bridge for the axial load. Okay, so in this basically what you are doing, that you are fixing this joint and you are preventing the rotation of the limbs. You are simply preserving this limb length. Okay, that is known as realigning or realignment of a bone when it is non-reducible. When it is reducible, it is a different thing. you can do the reduction. Okay, but when it is non-reducible, your prime objective is always preserving the limb length. Okay, that is realigning. So this is reducible and non-reducible, you got it, which can be reduced, whether the open reduction or closed reduction. We'll discuss in the next class. Okay, both the procedure, it can be possible, that is reducible. Most of the oblique transverse fractures or both very minimally comminuted fracture, those can be reducible, while the severely comminuted fractures are non-reducible. Okay, next, on the basis of location, where it is located, the fracture line. Before going to that fracture line, let us understand some basic anatomy of the bone, because some classification is there. So here you see, this is diaphysis. You can see, you see this one, this picture. Okay, this is diaphysis. Here it will be metaphysis. Can you see this plate here? Okay, this is growth plate. This is epiphysis, and this is articular surface. Similarly, here this is articular surface, this is epiphysis, and here is the growth plate, metaphysis and a diaphysis. Understood how this works? Articular surface, epiphysis, the growth plate or physis, sometimes known as physis, metaphysis and diaphysis. Let us jump into the classification. The classification can be, first let me tell you, classification can be articular, when the fracture is to the joint surface, articular. Epiphyseal, I told you, this is epiphysis, epiphyseal fracture. Physeal fracture involving the growth plate. Metaphyseal, fracture of this metaphysis. Diphyseal, most of the common fractures are diphyseal. So these are diphyseal fractures. Okay, these are self-explanatory. Important one is the physeal fracture, because the physeal fracture is further subclassified by Salter and Harris. This is known as Salter-Harris classification. Okay, Salter-Harris classification. In the previous class, while discussing the buttress fracture, I told you about Salter-Harris fracture. So the Salter-Harris fracture is of 6 types. Here 5 types. There is another one also 6 types. So how to remember this one? The name itself is enough for remembering. This is S A L T E R. Salter. S means straight through physis. Straight through physis. Straight, the fracture line is straight through physis. This is type 1 Salter-Harris fracture. A for above. So above the physis you will find metaphysis. So part of metaphysis will be fractured. Along with physeal line, the line also connects the metaphysis. So the physis plus metaphysis. The A, above the physis. L is lower to the physis. Along with physeal fracture, the epiphysis is fractured. So this is L only physis. This is physis plus metaphysis. This is physis plus epiphysis. Okay, L means lower to the physis. Lower to the physis, this is epiphysis. Okay, next is T for through. Okay, this is through. Here we will find physis along with the epiphysis and metaphysis. Okay, this is through and through. Okay, T for through. E R for erase, completely erased. Okay, the physis is completely compressed, completely erased. Okay, ER for erased. There is another one, that is type 6 or types VI6, in which there will be partial compression. One side will be intact and other side will be gone. Okay, SALTER. These 5 types you will find everywhere. The 6th type was in this book, so I was explaining. So normally you can Salter, straight, above, lower, through and erase. Salter classification of the physeal fractures. Very easy to remember, nothing to worry. Okay, now when you will see some physeal fractures, classify, okay, whether which type of Salter-Harris classification. Next is displacement. The fracture can be displaced or non-displaced. So the displacement usually it involves or it is written in relation to the proximal segment. Here this is proximal segment of the bone, distal segment of the bone. Okay, so displaced means whether the proximal segment is displaced or not. Here it is cranial displaced, so it is cranial displaced fracture. Okay, so why the displacement occurs? Because of muscle contraction. Okay, when there will be fracture and the muscle will be contracted, so it may get displaced. But this one is a non-displaced fracture because it is nearly in opposition with each other. So this is non-displaced fracture and this is displaced fracture. Remember, the displacement is in relation to the proximal segment. This proximal segment. Next is the bone. Which bone is involved? And also the side, whether the left side or the right hand side. This is femur bone. Okay, this is tibia fibula, and this is the humerus. These are phalanges. Okay, like this you have to write that which bones are bones are involved. So on that basis also you have to classify the fracture. So going to our first slide, how to write the fracture. That is, first one will always be the skin bridge, whether the simple or compound. Okay, so just revising, simple or compound. Next is the fracture line. Fracture line can be on the basis of completeness, complete or incomplete. On the basis in relation to the axis of the bone, it can be two-piece fracture. Sorry, I am really sorry. Transverse fracture, oblique fracture, or spiral fracture. The oblique is further subdivided into the short oblique, long oblique. Next, on the basis of spiral is also oblique fracture. Next is whether number of pieces, 2 pieces, then the 3-piece or the segmental fracture. Next is the butterfly, 2-piece with a butterfly. Next is the comminuted or the comminuted fracture. Comminuted can be further subclassified into minimum, moderate and severe. Okay, next is the on the basis of reduction, whether reducible or non-reducible. On the basis of location, whether the articular, epiphyseal, physeal, metaphyseal or diaphyseal. The physeal further classified into Salter-Harris classification 1, 2, 3, 4 and 5. One is basically the physeal. Remember, SALTER, straight through physis, above physis plus metaphysis, lower physis plus epiphysis, through physis, epiphysis and metaphysis. Erase, complete compression of the fracture. There is also a 6th one where there will be partial compression. Next, displacement, whether the displaced or non-displaced, displaced or non-displaced on the basis of the proximal fractured segment. Next, bone, which bone and which side of the bone. So this is basically the detailed classification of the fracture. I hope now you can write in the examination. If it comes that classify the fracture, you can write very easily. Okay, so the note to this particular class is in the description. Do check that out. Also, this PPT is also in the description. I have given the Google Drive link. You can check that also. So we'll meet in the next class. Next class we'll be discussing the orthopedic patient management and the fracture assessment scope. Okay, so till then, tata, bye bye, take care.